Hi, my name is Dr. Melissa McRae, and I'm from Vitality Natural Wellness and Med Spa. We're here in Powell today, and I wanted to tell you a little bit about what we do. People ask all the time, what exactly do you do? Well, I'm going to tell you a little story, and I'm going to explain exactly what happens in our practice. So I'm going to tell you about this really great lady. She's a 34-year-old mother of two, incredibly busy. They play travel ball. She's running all over the state, even out of state actually, but she's also in a high administrative level in the business she's in. So she works out of her home, but she also works at an office, and she seems like she can never get away from work. So she actually came to the office. She heard from a friend that we helped her with her energy levels. So this person's main concern was, I want more energy and I want to lose weight. So she already works out 6 days a week, can't seem to lose weight no matter what she does. She wakes up, gets up and going, mid-afternoon crashes, and at night she just is so exhausted. If she could take a nap in the middle of the afternoon, she would. So her concern was, is there something wrong with me? Or do I just, is it just the stress of life that I need to kind of deal with? So she came into the office, we reviewed her lab work. We like to get labs before someone comes in, so we have a lot more information to work with. We reviewed her lab work. It showed a couple of pretty significant things. First of all, she had multiple nutritional deficiencies. Her hormones were definitely out of whack. Her thyroid was off balance, and she also had issues with leaky gut. She, again, a lot of the things she kind of just wrote off because of her busy schedule. She thought she ate pretty well, but at the same time, she always felt bloated and just, again, having a really hard time losing weight. So it was really interesting to find out the different issues that she did have going on. So what did we do with her? First of all, we optimized her hormones. There's a couple routes we can choose, but she chose bioidentical pellet therapy. If you want to know more about that, just check our site. We also treated her for leaky gut. She had to actually be able to absorb the nutrients we were going to give her. And if we didn't treat her gut, she was never going to do that. And the third thing we did is we treated her with peptide therapy. We are actually experts in peptide therapy, and it is an exceptional way to really facilitate healing in a quicker manner. So at her follow-up visit, her energy, she noted, was much better. She didn't need her afternoon nap anymore. Her bloating was completely resolved. She had lost 6 pounds since she had been in 30 days prior to that, and she felt like she was just able to handle her stressors better. Now, that's all good, but she still wasn't feeling as great as she felt she could feel. None of those things that we dealt with are instant gratification changes. This is a process, and we still had issues we were dealing with. She still needs the nutritional support. It's the foundation of everything that happens in her body. So we know we have some areas we need to work on there, but we were making some significant progress, which was amazing. So with this treatment, what we did for her is we used another peptide. Again, she was feeling good. She wanted to feel great. So we chose a peptide called CJC 1295 with ipamorelin, basically a really big name, but what it does is it gives her deep, restful sleep. It gives her energy through the day, mental clarity. It helps her with concentration and focus. So all those things that are going to really help her rest better. It's going to help her live her life better. And at the same time, it's going to support all those things we need to happen on the inside. It's going to help her body from an adrenal standpoint. It'll help her body from a thyroid standpoint, and just it's going to also help with her gut healing. So that's exactly what we do at the office. You come in, we take a look at your history and what your issues are, and then we do our absolute best to optimize your health. So again, I'm Dr. McRae from Vitality. I hope that helps you out.